My name is Nala. And I am an activist against female genital mutilation. Everything started with my childbirth. My father told me how happy they were waiting for me. One day my mother starts to feel too much pain, so they believe it is time to have a daughter, so my father quickly took my mother to the health center of our community. It seemed that my mother was suffering a lot, so she had to enter by emergency. My father just waited in the room until he heard the cry of a baby. He could see me through the glass of the door, but quickly the doctors covered everything with curtains. 1 hour ago, the doctor came out and told to my father, "I'm sorry, but she didn't resist, she died." The doctors found that my mother had been a victim of female genital mutilation at an early age, something common in Nigeria and other countries of Africa. However, due to the lack of medical attention during her childhood, adolescence, and even in pregnancy, she could never detect this problem that causes her death. My mom's story is one of many reasons I became an activist. I have focused on making visible, raising awareness, and disseminating scientific evidence of a woman's consequences after undergoing an FGM. FGM refers to all procedures involving partial or total removal of the external female genitalia or other injuries to the female genital organs for non-medical reasons. This procedure implies medical complications that will depend on the type of cut made during genital cutting. Type 1, excision of the prepuce and part or all of the clitoris. Type 2, excision of the prepuce and clitoris together with partial or total excision of the labia minora. Type 3, infibulation. Excision of part or all of the external genitalia and stitching together of the two cut sides, to varying degrees. Type 4, pricking, piercing, incision, stretching, scraping, or other procedures harming the clitoris or labia. Female genital mutilation is practiced in most cases in childhood, even a couple of days after birth. On other occasions, female genital mutilation is carried out during childhood, during marriage, during a woman's first pregnancy or after the birth of her first child. Recent reports suggest that the majority of cases of female genital mutilation are performed on girls aged 0 to 15. Female genital mutilation offers no health benefits and often has short and long-term physical and psychological consequences. In general terms, the risks and consequences of genital mutilation increase as the severity of the procedure increases, which in this case equals the amount of damaged tissue.
Immediate physical complications can include bleeding, inflammation of the genital tissues, and fever. The ablation of nerve endings and sensitive genital tissue causes severe pain. The use of surgical instruments without sterilization can increase the risk of HIV transmission and the development of infections such as tetanus. The long-term consequences can be urinary tract infections, vaginal problems such as leukorrhea, bacterial vaginosis, dermoid cysts, abscesses, genital ulcers, kidney failure, septicemia and death. Mutilated women are at risk for difficult labor, postpartum hemorrhage, cesarean section, stillbirth, or premature death. A possible relationship between genital mutilation and obstetric fistulas is being investigated. Some studies have shown that female genital mutilation increases the probability of being afraid to have sex, and of suffering from post-traumatic stress disorders, anxiety, depression, memory loss.
The World Health Organization calculates that between 100 million women and girls in the world have been victims of some kind of FGM. FGM takes place essentially in 28 countries in sub-Saharan Africa, northern Iraq, Malaysia, and Indonesia, plus Europe, United States, and Australia, among many other countries where migrants carry along their culture. Ending female genital mutilation requires action at many levels, including families, communities, and protection and care services for girls and women. Likewise, it requires laws and political commitment at the local, regional, national and international levels. UNICEF and the United Nations Population Fund lead a program for the eradication of female genital mutilation, which promotes zero-tolerance laws and policies, while working with health institutions to assist women and girls who have been subjected to it. In 2015, world leaders supported the inclusion of the elimination of female genital mutilation in the targets of the 2030 Agenda for Sustainable Development. However, in 2020, the COVID-19 pandemic has negatively affected girls and women, leading to the obstruction of the achievement of this target.